The South African Medical Research Council says moments like COVID-19 present an opportunity for more young scientists to emerge. The Medical Research Council says it's crucial to invest in future young scientists, particularly in the health sector. To help us find out how the institution has been preparing more scientists, we're joined now by Dr. Thabi Maitin, Division Manager at the South African Medical Research Council. A very good morning to you. Thank you so much for your time. Now more than ever, young scientists are needed to help in the fight against COVID-19. What are some of the challenges and obstacles that come with young people entering the field of science?
Thank you. Thank you for your time. The challenges that young people are actually facing at this time are just opportunities. Opportunities to enter the space of science in a meaningful way and to realize their dreams, what they have in their minds. And that always just translates into entry into the postgraduate space and sustenance, financial sustenance during that time to ensure that people start and finish their degree training.
As we assess this unprecedented time that we're in now, just really looking to the pandemic and what the world is currently experiencing, how important is it to have more scientists?
Oh, it's very, very important. It's important because we shouldn't wait until we get into the space in which we are right now, where we're facing not just a pandemic, but a crisis. So it's important that opportunities are created by seasoned scientists who can focus such things and help us to prepare for this. In the scientific world, we call it a pandemic preparedness. So it means that we need to train our young doctors in these fields of pandemic preparedness, because today it may be COVID. We don't know what next year might be like, but if we have the scientists that we have trained with PhDs, they can help us to focus these things, to prepare for them, and to bring in the whole health team, because it's not just medical doctors that help a country or a situation get over these things. It's the whole health team. The important thing is that it must be researchers that are skilled in their expert areas.
And what are some of the most important, perhaps the more popular areas of research within the space of science?
Well, up to now, I would say that it has been HIV for obvious reasons, because that was affecting disproportionately the number of people that were sick from that, and therefore it was presenting a very heavy burden on the health system, financially and otherwise. But we're seeing that now is now in the space of it's got to be managed. There is no longer a serious panic around it. Now we know how to manage a situation of HIV. So we're in the space now of making sure that people are compliant to the tested processes that help to manage this particular pandemic it was, in fact. So it was HIV, but right now we are seeing a concerning emergence of in the space of non-communicable diseases of lifestyle, cardiovascular, diabetes, hypertension, and all of that. So now it means that we need to train our young people, the new PhDs and clinician scientists that are coming in, need to invest knowledge in that space so that our people know how to, what it means when we say that you are at risk now for a cardiovascular disease. What does it mean for you when you're sitting at home? Mm-hmm. So we need people that are going to help us get that message across, and it must be real on the ground. It mustn't just be science, it must be words. Science must be translated into your day-to-day language for the layperson on the street.
Mm-hmm. As we observe Youth Month, as we go into the focus being on young people in South Africa and access to jobs and access to career industries, what is the very strong message that you'd like to send out to young people who may be considering pursuing their careers in the space of science, or perhaps hesitant to do so? What is that message that you'd like them to know?
Well, I'd like them to remember that they're South African. They're South Africans. That means that we're winners. That means that we are resilient. That means that if you didn't get an opportunity this year, you need to try again, because we have the most valued asset. You have the human capital, you have your brains. That is not a question. We know you'll succeed. So now we just need to create the opportunities, but you need also to put yourself out there in the running. You need to throw your heads. We need to be bombarded by these queries and questions of how to get into the space of being a PhD. As a Medical Research Council, we need to have a good problem, as it were. We need to say that, oh my goodness, so many young people are needing funding. What are we going to do about that? At this stage, I must say, it's a bit of a skew, the kind of interest and appetite that we're getting. So we need to really make sure that the footprint of whom we call a researcher in the Medical Research Council, we can say that it's the whole of South Africa. We shouldn't say that it's a certain sector or certain universities. We're working hard to achieve that. And we're very positive and we're excited because the kinds of young people that we're funding at the Medical Research Council are just doing amazing things. That's why I'm saying I'm not worried about the excellence of our young people. I'm worried about, can we just have enough resources to take care of this valued asset of ours?
Thank you so much for your time. We're going to have to leave it there for now. From the South African Medical Research Council, Dr. Thabi Maitin, saying that young scientists are needed